There are increasing pressures on general practice. Consultations seem to be getting more complex as medicine gets more complex, and having things like QOF targets and QP indicators.
People have very complex needs now that seems to take longer.
We've got the changes to commissioning in 2013, the threat to our budgets.
And with expenses going up, most practices are actually seeing revenues falling. But at the same time, more work is being devolved into primary care.
The approach to accessing healthcare from the patient's point of view has a kind of consumerist feel to it.
When you involve patients, they feel more empowered and they feel that it's their practice rather than just turning up to a doctor's.
So we're all looking at the bottom line to make the best deal that we can for our patients.
Of course, one way of dealing with extra demand for extra work is to just employ extra people. But in a resource-limited organisation like primary care or GP surgery, we just don't have the resources anymore to do that.
Throughout the NHS, throughout society really, there's a continual expectation to deliver more for the same or even less.
We've got an opportunity with Productive General Practice to make sure that what we're offering is adequately resourced and we're using the staff, that's clinicians and admin staff, to the best of their abilities, and we're making the best use of those resources.
Productive General Practice was created in collaboration with 17 test sites across the country, who helped to shape all the modules and programme guidance, ensuring they are relevant, practical and accessible. The programme received input from practising GPs, practice managers, nursing and reception staff, as well as experts in best practice operations management, lean thinking and patient involvement, and the work was done in partnership with NHS Scotland. Very easy to use, requiring no previous improvement knowledge from the user, it takes the form of a house, divided into small manageable chunks called modules.
The design of the house was built on our development days, where our colleagues very kindly came up, gave up their time and made a list of their frustrations. Having taken that list of frustrations, we could then take that to the test sites and say, what does that mean? Which sections is? How do we approach this problem? That's how we get the module. The practices expressed frustrations, we gathered those frustrations together and we devised modules to deal with those frustrations.
The Productive General Practice modules are really straightforward. Each of the modules comes with its own booklet, with step-by-step instructions for everyone involved in the project, and it actually enables you to go in a very methodical way from looking at the problem and coming up with the best solution.
It's really about these written materials triggering and stimulating discussions in the practice. It's these discussions that we often know that we need to have, but are often really just too busy doing a kind of day job to be able to kind of carry on and do.
So the modules form a house with foundation modules building up to other modules, and the reason it's done like this is that the entirety of the house is what is important rather than just the component parts.
Each module looks in depth at up to 5 areas of practice, enabling you to engage practice staff in improving your work processes and the quality of the service, so you can release time to invest in improving patient outcomes and staff well-being. To get the best out of the programme, it's important that the modules are done in sequence, starting with the foundation modules and moving on to the design and the process modules. Here are just a few examples of what others have already achieved.
One of the receptionists took a camera and actually went around the reception area and took photographs, and everyone was shocked how bad the reception looked. They'd gone out, they'd bought the plastic boxes, they'd marked everything up, they'd put everything in right areas. The stuff that was in the bins we could have actually had a skip to fill. And now it's great. Patients have actually come in and commented how tidy it actually looks.
For part of the consultation module, we did some peer-to-peer observation, identifying potentials for time saving, and we came up with a list of forms and equipment that would be standardised across all the consultation rooms in the practice. We now have an admin staff member who's responsible for restocking all the forms, and one of the practice nurses is responsible for restocking all the equipment, and we found that that has definitely started to save us all small amounts of time. Sometimes that might only be 30 seconds or a minute, but when that's taken over the course of a session or a day or a week, that actually frees up quite a lot of time.
As GPs, we were getting an awful lot of interruptions. One of the things receptionists were finding difficult was judging when a prescription was clinically urgent and when it wasn't. So as GPs, we put our heads together and identified a list of about 4 medicines that probably should be issued urgently. If a medicine that was being requested was not on that list, it almost certainly could wait until later on in the day. We've done an audit which has shown, I think, that the actual number of interruptions is reduced by 50%.
We were getting many requests for medical reports, and the GPs often held on to these for quite a long time. The result of that was that the back office and even reception were getting chasers from the insurance companies asking where the medical reports were.
When they actually looked into that, they realised that there was an allocation problem, and that I was actually being allocated the bulk of the paperwork for the practice. So when they then streamlined that into appropriate allocations per doctor, I suddenly found that I could concentrate better on my work, I could go home on time.
And the result of that was that we were getting less queries from the insurance companies and less queries from our patients as well.
One of the interesting things that's come out from involving patients in improvement is understanding just how important to them issues of confidentiality and patient dignity are. It wasn't something that we would necessarily have put as top priority, but when we engaged with that patient group and talked to them about the things that really mattered to them, it became really clear that issues of patient confidentiality really were number one on the agenda for them.
Shaping our future practice is a step back from the position we've evolved into. In stepping back and looking at the problem globally, you can make fundamental change to the way the practice operates.
Shaping our future practice really enabled us to take a look at all our patients and actually see if we could actually put those patients into certain groups that were predictable, and just to see if we could design certain pathways for certain types of patients, which would mean that we could actually help to manage them in a different way.
We have become increasingly constricted by treating diseases in their individual silos, and to be effective in offering services to patients is often better, and we learn from looking at our data that it's better to deliver things in a more generic way for their condition.
We found that there was some of our patients were already coming in for appointments for their chronic diseases that were part of QOF, and obviously there was opportunities there to actually look at their whole health. So we were cutting down on telephone calls to the practice, more letters going out, so we're actually managing the patient as a whole rather than in a disjointed way.
There's so many things that I've always had in the back of my mind, like, oh, wouldn't it be nice to do that? And that could do with being changed or sorted through. But it's always well, I have to do that when I've got some time to do it.
I think productive general practice could be the set of tools that practices have been waiting for. I think we've never been in a situation where general practice is expected to deliver so much.
It's given us the chance to get alongside the patients to see what they're thinking as well as what we're thinking. And if we do things together, we've realised that we provide better patient care.
The whole outlook of the practice, the focus has changed, people's behaviours changed. It's nothing but positive.
As a whole, I think it's brought everyone closer together because we're all going through it together, we're all getting different things out of it.
A lot of hard work to start with. You've got to invest a lot of time, but at the end of the day, you're going to end up with a leaner, more efficient, happier practice.